You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. Have you ever had a sudden jolt of pain in your knee? You know, it's not uncommon. I hear that a lot, and it's actually happened to me a few times. And it can be scary. I mean, knowing what I know, I sort of have an idea and understanding of what it may be. But sometimes even knowing what I know, I'm not really sure what caused it. So when patients go through that, they can become extremely scared and concerned that it may happen again or that they did something wrong. So we're going to talk a little bit about things that may cause this sudden jolt of pain. Now, this is very different than you falling and hitting the knee and having pain. I mean, you could damage something, have a fracture, tear a ligament, tear a tendon, or people that have a chronic issue with an instability of a ligament or arthritis and have pain. That's a different. I'm talking about your pretty much normal everyday activities, no real knee problems, and turn or twist and get one sudden jolt of pain that just stops you in the tracks. So why does that happen? Well, how many times in your life have you chewed food? A lot, right? How many times have you bit the inside of your cheek? And it hurts, and it's painful, and then it gets swollen, and it may bleed. And then if you're not careful later that meal or later that day, you might bite it again because it's puffy and sticking out. Well, a similar thing can happen in the knee. The lining of the knee is called the synovium. And this is a lining around the inside of the joint that produces fluid and absorbs fluid. And occasionally that lining of the knee joint can get caught, between the bones. So you turn and twist. And it's basically essentially like you biting down and catching your cheek between your teeth. So it hurts. It's sharp, it's sudden, it may not happen again, it may cause some swelling, but it usually tends to go away. And that, like a lot of these things, if it's sharp, sudden, goes away and there's no symptoms, you don't need really any treatment. If it's sharp, sudden, and you have some pain and swelling, like I've talked about in previous episodes, the initial treatment can be ice and some rest and some compression and maybe some over-the-counter pills like an anti-inflammatory or acetaminophen if their use is not contraindicated for you. Now, occasionally, you can get a little bruise of the bone. So if you've ever had a black and blue mark, maybe you got hit with a softball in the arm or you smacked your leg on the bed at night trying to go to the bathroom, that bruise is sore. And, what happens is we always tend to bang that spot again the next day. And it hurts even more than it did before. And you can get these bruises in the knee. Occasionally, we'll see it on an MRI because someone has pain, the x-ray is normal, they don't see a fracture, they get an MRI, and it may be termed an insufficiency fracture. Sometimes just a bone contusion, but most commonly they're mild and subtle, so you don't even see a doctor get an x-ray. But you'll have a spot that maybe is sore and achy, but you bend and straighten it, and it just gives you this sudden, sharp jolt of pain. And then it goes away. So what happens is that the bone is bruised. Now, why does this happen? Well, as we get older, if the bone is getting weaker, say from osteoporosis, you may be doing normal activity, but the bone is not as strong as it once was, so it may break down a little bit and cause this little bit of a bruise. Or you can have pretty normal, healthy bone, but do excessive activity. So someone's on vacation or they go on a long walk, which is very different than what they typically do. And that one long walk causes a little bruise in the bone. And again, they may not notice it much more than just, they feel a little sore, stiff, or achy, but there's a bruised area. And then what happens is you bend or turn or twist your knee in just the right way and you touch the bruise. Maybe the thigh bone touches the shin bone where the bruise is, and it gives you that sudden, sharp jolt of pain. That can be extremely painful. So you want to just kind of back off, take it easy. And again, usually that goes away. Now, what about tearing the cartilage? So I see a lot of people after they've seen their primary and after they've had an MRI, and the MRI shows a meniscus tear, and they'll just say, I had this sudden sharp jolt of pain. I wasn't playing tennis or doing sports or falling. I was just in bed, or I was stepping off a curb or getting out of a chair. So it's not a traumatic thing, but they get this sudden sharp jolt. Now, the reality is we cannot prove that the meniscus tear that you see on your MRI was the thing that caused the sharp pain. But as we age, the meniscus will age with us. And as the cartilage and collagen fibers in the meniscus age, they can get weaker and they're more prone to breaking. You may have heard me talk about this analogy before. This is the rubber band that's been sitting in your desk. You don't overstretch it to wrap a stack of envelopes. You just pull it out gently and it breaks and you throw it in the trash. Well, you don't want to throw your knee in the trash, but occasionally you just turn, twist, do whatever, and the meniscus tears. And it may cause sharp, sudden pain. The meniscus will not heal. You don't necessarily need to just rush into surgery if you had a one-time episode of pain. And sometimes that pain goes away, but it's possible that you may have torn the meniscus. Occasionally, you can get sharp snapping pain. This is more common if your tendons, ligaments are tight, and especially if you have some arthritis with bone spurs or a little knock knee or bow-legged deformity. And what will happen is you'll turn or twist, and the band of tissue will snap over the edge of your bone, and it causes this sharp, sudden pain. Occasionally, it feels like your leg dislocated, and it doesn't happen again. And what that is that band of tissue just being tight and rubbing over the edge of the bone. So imagine taking a rubber band, stretching it gently so it's taut, and putting it at the edge of your table right at a corner and rub it to the corner. And then as it goes to the corner, your fingers keep going, but the rubber band gets caught and then pop, snaps over the edge. And at that point, that's the sudden painful pop that you feel. And the other thing that can happen too, which isn't necessarily a pain that's sharp, but it's a common thing that fits into this scenario, is I get a lot of people that will come in with this sudden, acute, painful, swollen knee. And they wonder what happened. So, the first thing is taking a good history. So are you on a blood thinner? Do you have some heart disease or other disease and they have you on Coumadin, which is warfarin, or Eliquis, Xarelto, Plavix, Pradaxa? I mean, you name it. There's a whole lot of blood thinners out there, which all have good reason to help other diseases. But the downside of a lot of those pills is that they do cause bleeding. So occasionally you don't do anything major traumatic, but because you're on this blood thinner that thins your blood, you bleed into your knee. We also see this with certain people that have genetic disorders that result in abnormal clotting. You see it mostly in hemophilia, but there's other diseases like that where all of a sudden the knee blows up like a balloon. It's swollen. It's painful. And usually it's treated conservatively. Your doctor may have you hold the medicine if you're on that. But again, for all of these sharp, sudden, one episode, non-traumatic issues, you want to just take a step back, treat it conservatively. Wrap it if it's swollen using an ACE wrap or a knee sleeve. Ice it diligently. Use an over-the-counter medicine such as Motrin, Tylenol, Advil, Aleve, ibuprofen, naproxen, acetaminophen. Based on your health history, you should check with your primary to see which ones of those would be safe for you. And most of these will resolve, in a couple days. Again, if it's traumatic, if you fall, you can't bear weight, you have pain which is getting worse, not better, or pain that isn't going away, that is a time to get in to see your doctor and get a further exam. But these one-time episodes can be multifactorial. They can be scary. Sometimes we're never 100% sure as to what somebody did. But these things are some of the more common things that I see that cause these sort of acute one-time episode symptoms. And once patients understand that, luckily for them, a lot of them doesn't happen again. And it kind of puts their mind at ease, but then it gets them back to living their life. So I hope that it's answered some of the questions that you may have. I hope that you've found the information helpful. If you know somebody that would benefit from this information, please share this podcast information with them. And if you like what you're hearing, please leave a review. I will talk to you next time. Once again, I'm Adam Rosen, and you've been listening to the Your Knee, Your Health podcast. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.